You're wondering how to treat your child's bee sting. My name is Beverly Bitterman, ARNP, Health and Wellness Consultant, and I'm here to give you a few tips about how to do that. The first thing that you want to do is to, of course, calm your child down. Sometimes it's helpful to give them a glass of water to drink or something like that to distract them and get them to quit crying. Then what you'll want to do is look at the site of the sting. And you don't want to pinch out the pincher if it's still in there. What you would do is, if it's, say, a sting on the arm, is you would take a clean, moist cloth and just sort of wipe it down, and that will also help make sure that it's clean. Then what you can do is you can mix up a little bit of baking soda and water and make a little paste and put it on there, hold it on there with a wet cloth. You could put something cold on top of that, maybe even a freezer pack, or maybe you have a first aid kit where you can have one of these handy dandy instant cold compresses that you can put on top of that baking soda. The other thing that you can do if the child complains, or perhaps it's several hours after the bee sting and they're still feeling upset and uncomfortable, is if they're over about 2 years old, you could check with your pediatrician to be sure, but you could probably give them an analgesic like Tylenol with a antihistamine in it. So in other words, something that you might use for a cold could help reduce the inflammation from that bee sting. Of course, if your child has any shortness of breath, if the redness is spreading, if it gets to be greater than about 2 inches wide, you probably ought to consider consulting your pediatrician and see if there's anything else that needs to be done or can be done. In case of any shortness of breath, you'd want to make sure that you get your child quickly to an emergency room. Again, my name is Beverly Bitterman, Health and Wellness Consultant, and I wish you good luck in calming your child and getting that sting to go away.